Good morning everyone, it's Wednesday morning, so it's time for our level 1 mat class with more of an emphasis on back care. So if you have a non-specific back issue, so it might be upper back and shoulders or lower back that's causing you pain and aggravation, this is a great class for you to join in with. If you do have specific back issues that have been diagnosed, and you know how to exercise yourself safely, because I've given you modifications in class, please do try and remember those, keep your body safe, but do remember I will keep cueing for certain exercises, things that we should or shouldn't do. Okay, so as always I need to let you know you're taking part in this class at your own risk, so do make sure that you listen to your bodies. We never work through pain. Muscular effort is good, that's fine, but pain into the joints especially, or nerves, is your body's way of telling you something isn't right, so you might need to just step that exercise back a little bit, modify it, so do listen to any little modifications that I might give that could make that exercise accessible for you in a slightly different way. Okay, have we got a nice, safe, clear working area? No trip hazards? And could you just grab your band if you've got it, because we're going to be following on from last week doing a bit of band work. Just hold it up, just look down the edges and check that there aren't any nicks or tears in it, so that it's not going to go ping and cause us any problems while we're working this morning. So we're going to start without the band for a bit of a warm-up. So I'd like you to make sure that that is safely out of your working area, you're not going to trip over it. So I'm going to pop mine over here so that I know exactly where it is, but I'm not going to trip over it. Now if you need to grab yourselves a drink, maybe something just to sip while we're working today, then please do grab that. And I've just realised I haven't put my phone on silent, so I'm just going to adjust that. There we go. Don't want disturbing while we're having our class, do we? Right, so let's have a look. It is 10 o'clock, so it is time to start. So good morning to you, those of you who are joining in this morning. We're going to start in standing today, but we're not going to stay in standing all that long. We're going to try and do quite a bit more down on the mats today. So I'd like you to start in your good standing posture, so that's heels under the hip bones. Just check that your toes are level with each other, feet are parallel, and feel that your arches are lifted so that you've got the pressure in the middle of your heel rather than the inside edge or the outside edge. Okay, toes are spread out. And who have we got in this morning? George, good morning. Okay, so toes are spread out, and then we're pulling up through the muscles of the legs, but without locking into those kneecaps. So just check for tension in the top of the kneecap. Just allow those to be soft, but the legs are straight and pulled up. We've got the pelvis in neutral, so think of lifting those hip bones and using the abdominals to do that rather than squeezing the glutes, because all that does is push your hips forwards. It doesn't resolve the issue of getting the core active and correct placement of the pelvis. Let's open those shoulders, just roll them back and down. And again, think about how the rib cage is moving as you do this. As you squeeze those shoulders together and down, does that bottom rib feel like it wants to pop forwards? Just see if you can keep it under control. So all that movement is coming through the shoulders. Let's take one more. Breath in and a breath out. Now our aim is to line the ear up with the middle of the shoulder. So let's think about retracting that chin so that the end of the chin is over your collarbones, and lifting the crown of the head rather than the forehead. So we're looking straight ahead of us. Okay, we're going to begin with some sways. I'd like you to start off quite small and just see how your body reacts to these today. So spreading the toes out, we're going to press forwards into the toes, and then try not to lock the knees as you go back into the heels. So you might find that this movement is very small, how different things switch on as you move forwards and back. Make sure that breath is flowing, long deep breaths in through the nose and out through the mouth. Now if you can feel that you're not bending at the back or bending at the hips or locking your knees out, so really taking care of those kneecaps, can you go a little bit further with that? So could you make those sways a little bit bigger? Do you feel confident too? Don't worry if you need to step out of it, that's fine. You're just keeping yourself safe. Now how does it feel if we then start to add in arms? If we take the arms slightly forwards as we go forwards, and what about squeezing the shoulder blades together as you go back? Forwards and back. You could feel, if you're confident to, a little lift of the heels or a little lift of the toes. But if that starts to compromise your posture, that lovely upright posture that you've got, then just stay with the feet flat. We're going to do one more each way. And then still working in this plane of movement, let's come into foot pedals with opposition arm. Let's wake those feet up. Lifting the heel and lifting the arm. Remember, we're lifting the arm from the little finger. So keep that going for me. Alternating side. If we lift from the thumb, you can see how that draws the shoulder up and it tightens these muscles here, which in most people are already a bit too tight. We want to work the muscles down here, so think of lifting from the little finger and keeping that shoulder down and the neck long. Now let's do a couple more. And then let's take a stretch up, and then we're going to open the arms out wide and down. Now we're going to go into sways to the side. Just rolling over into the sides of the feet and really trying to keep that alignment. So just watch for pushing the hip out and keeping your shoulders over your feet. We want to make sure that everything goes together. So it might be very small, but can you start to feel the sides of your body switching on? Okay, resisting that bend, holding you upright. This is starting to remind me of a rather eventful trip on a ferry across the Isle of Man. One more. Now, could we start to add in some arms as you go over to the side? How does it feel if you take the arms out? Is that loading the body too much, or does that feel alright? So we've just got an extra level to add in. One more each way. Okay, continuing that side to side theme, let's peel up and come up into a knee lift. Now can you step that leg out to the side and come into a squat for me? So long spine, pelvis stays neutral, chin is nodded. Now step back onto that leg, pull up. Can you lift the knee without dragging your foot back in? Step it out. If you need to keep this really small, so knees are over toes, just hover it back in. Can you just bring it back in? Just a little knee bend, doesn't need to be high. If you need to step that foot down in between, that's absolutely fine, but just keep it at a level where you feel confident. Okay, keep it low. And in. One more. And in. Now we're going to step that leg out to the side once more, but just rest onto the big toe. Pull up on this standing side. let's take the arm out if it'll go, if that feels all right for you. Reach, and can you lift the toe and tap? Just a tiny lift. Feel it right here at the side of the hip. If you're feeling it in the front of your thigh, your leg is coming forwards. So just try and position it where you feel it right here at the side. And draw it back in. Okay, just give me a little mini squat. And up, just release that standing leg. Little mini squats. Couple more. Remembering to keep that chin nodded. Okay, we're ready to go to the other side. Let's pull up tall. Peel up. Remember, it only needs to be low. Lift that toe, step it out. So we're thinking about control here. Knees over toes in this squat. Push up onto your standing leg. Bring it in. Peel it down. You can lift that knee higher if you feel confident to, but stay with me if you're not feeling too great about your balance today. Just keep it very low, only just off the floor. Brilliant. Chin's nodded. We're lengthening the crown of the head forwards. One more. And we come up into that knee lift. Remember, we're going to step it out again. Just rest the big toe down. So try not to have any weight on it, any pressure on that foot. Pull up on your standing leg. Let's extend that arm. We're going to lift and tap. Just keep it small if you need to. We've got two more here. We're reaching away with this arm and bringing it back in. Okay, let's give those shoulders a roll. And we're nice and warm now. Let's do a little bit of a spine warm up. We're just going to move very gently in different directions, just get the spine warm. So I'd like us to start by stepping the feet not quite as wide as you normally would for a squat, but just a little bit wider than hip distance. Come into your hinge and then into a small squat so that you can place your hands on your knees. Okay, the chin is nodded, and I'd like you to very much focus on the lower back here and on the pelvis. This is where we're moving from. So notice if you just move into your shoulders. We want to keep this part of the body still. Take a breath in. Now don't force this movement. Exhale, just see if you can lengthen the lower back a little. Inhale, return. It's a very small movement. Exhale. Keep that going for me. So it's the breath out where you draw up, and I'd like you to feel like you're gently pulling your hip bones up towards your ribs, and your ribs might feel like they're coming down a little bit too. So this whole area is shortening, so that means the back is lengthening. We're not going to force this because disc issues, osteoporosis, certain spinal conditions won't like this if we force it and we make it a big movement, but we're just keeping the spine nourished and healthy with a bit of safe movement here. So let's do one more. And back. And then take the arms out as though you were in your squat and push back up. Right, we're going to come into a little bit of rotation now. So if you do have issues in the back that mean rotation isn't good for you, although how do we avoid it in everyday life? Let's have a little moment to think about that. Even if you've been told not to do it, how can you avoid it in everyday life? So how can we do it safely? Okay, we're not going to force the movement. We're going to make sure, especially if you have osteoporosis, that you allow the hips to move. Okay, so gentle, no force, but what I'd like you to really do is lift out of the hips. Now, can you feel straight away how you've got more core engagement? If we stay really tall and rotate, so osteoporosis, you're going to let your hips go too. If we stay really tall, then your muscles are activating more and your spine, the bones are taking less of the strain. Okay, so we're moving gently, exhale, Inhale. We're activating the core. So that's front and back. It's not just about abdominals, the core. It's about the back too. Let's do one more each way. And reach up, breath in. And down. So the last movement that we need to do for the spine, we've done a little bit of flexion, we've done a little bit of rotation, we need to do a bit of side bending. So back to your good standing posture, chin back. We're going to take the arms across the chest. Just lift the elbows slightly forwards and widen the shoulders. Let's lift out of the hips again and stretch over. And pull up. Inhale into that stretch and exhale, pull up. Breath out. Inhale. Exhale. And the taller you stay in this, the more you lift out of the hips, the more you're going to get that lovely switch on of those muscles. Okay, let's bring the arms down, give the shoulders a roll. We're going to grab that band now. So remember, you can do these arm ones with weights. So tins of beans out of the cupboard would be fine. Resistance band, if you've checked it, I said at the beginning, but maybe if you weren't on then, just check the edges for nicks or tears. Okay, and we're going to step onto that band for a bit of shoulder work. Okay, so I'd like to come back to hip distance, holding the band. Now you can either have fingers long and just tuck it into the thumb. If that doesn't feel secure, grab it with your fingers and rest your thumb on top of your fingers. So we're not gripping with the thumb, that's really important. Okay, inside of the elbow is forwards, not locked. And I'd like to have quite a bit of resistance there because we're working small range of movement, little muscles. Again, let's pull up tall so the core works as well. Breath in. Now exhale, let's just pull out to about 30 degrees and down. Breath out, we're pulling up tall. Can you start to feel this side switch on with that resistance? Exhale. The more we lift out of those hips, the more we're going to feel that lovely switch on. Let's go for two more. And let's hold. Can you give me some little pulses here? 8, 7, 6, 5, 4, 3, 2, and 1, and down. Wonderful. Okay. Swapping hands, but we're staying on the same side, ready for draw the sword. So you are on the front of the hip bone, not up on the top of the hip, on the actual pelvis. Shoulder back, standing tall. Breath out, you're pulling that elbow out to the side. Can you still see it out the corner of your eye? Shoulder is down, back to the hip. Pull up and back to the hip. This is an excellent exercise for anyone who has slightly dodgy shoulders, anyone who's prone to shoulder injuries or issues, particularly dislocation, because this works very specific muscles in the shoulder cap. One more, and down. Okay. We're going to swap, we're going to loosen the band because I'd like you to be able to go higher. So if you do have shoulder issues, just take it through your pain-free, symptom-free range of movement. Okay, pulling up tall again, let's feel anchored to the floor but lifting away from it. We'll take a breath in. As you exhale, we're going to pull up. Can you come up higher? And back down. So we're resisting taking the body with us. And this is a fantastic way of strengthening and exercising the core without putting the spine in any compromising positions. Okay, so all the muscles around it, all the muscles of the core are having to work really hard to stop you from wobbling and bending all over the place as you do that movement, but we're not actually moving the spine. So really good, really safe. One more. And down. Now you can stay with that if you'd like to. If you can, how does it feel if you take that leg out, take the other hand behind the back and pull up? Does that feel okay? If it doesn't, come back to feet hip distance. Now how much pressure is on that toe and is your foot stretched? No pressure on that toe, because if you can, could you lift? And down. If that's not available to you, just stay with the arm. And just notice as you do that, so keep that going, couple more. Do your ribs now start to pop? Really strongly exhale, keep the ribs down, we've got one more. And in. Fantastic. From there, can you step your free leg back onto the ball of the foot, and we're going to hinge forward. So I'm going to turn sideways for you. Keeping a nice tight hold of that band. You might want to shorten it again. We're holding it out in front, and you'll notice I'm hinged forwards. Shoulders over toes. I'm coming down into a lunge. As I push up, I'm going to give it a bicep curl. Pushing up and curl. Can you feel that hip bone coming down towards your heel? And your knees going over your toes. So that's as far as you go with a lunge, to the point where your knees are still over your toes. If those knees start to change direction, they're not going forwards, you've gone a little bit too far for now. Let's get some more strength into those legs. Okay, let's hold it here and bicep curl. 8, 7, 6, 5, 4, 3, 2, 1, and down. Wonderful. Let's step off that band and we can come to the other side. So let's pop the foot on, make sure that band is secure. We're starting with quite a bit of tension, remember, because we don't want the arm to move far. Again, lifting out of the hips. Pull up really tall so you get more core work, just pulling out to 30 degrees. Going for 4 more. Pull up tall. The moment you let go and start to sink, you're going to lose that core activation. 2 more. Now let's hold and pulse. 8, 7, 6, 5, 4, 3, 2, 1, and down. Right, swapping hands. Onto the front of the pelvis, remember, into that curve of the hip rather than on top of it. So you've got a diagonal line, back of the hand is forwards, shoulder is back, we stood tall. Breath in, lift and lengthen. Exhale, pull out. Inhale, back to the hip. So this shoulder is staying down, you can see the elbow out of the corner of your eye. So just make sure you're not working into the muscles that go up into the neck here. We want to keep that down, feel it all in the shoulder cap and a little bit around the back. Exhale. Let's do a couple more. Last one. And down. Wonderful. Right. Going back to a longer band now, we're going higher if that's available to you. So remember, don't grip with the thumb. Thumb stays aligned with the fingers, so whether you're gripping through the palm and fingers or you've got the fingers long, we're not wrapping that thumb around. Okay, elbow soft but straight. Take a breath in, lengthen. Now exhale, pull up. And inhale, come back down. How's it feel on this side compared to the other side? Did you feel like you wanted to wobble a little bit more? Or maybe you feel stronger and sturdier on this side? So we all have one good side and one not quite as good side. But we're aiming for symmetry, so let's really feel that work. What's activating here? We're going to do one more like this, and then are we ready to add in that toe? So if you feel you want to stay here, that's absolutely fine. If you can, let's take that toe out to the side. Just make sure you haven't pulled your hip up. So you want the hips level, but we're not sinking that way either. Ooh, difficult position. So we're pulled up on both sides, feel that hip switch on. Okay, we're just resting on that toe, we're not stood on it. Let's pull out to the side and down. So just notice if this rib wants to flare and go with you. Can you keep it down? You might even want to take your hand there and just monitor what's happening. Is that rib popping out? Okay, if you can, if you'd like to, join me in lifting the toe. And down. So really pulling up on that standing leg. Lift the toe and down. Let's do two more. And one last one. And in. Okay, just roll the shoulders. Let's step the leg back, ready for our lunges. So again, I'm going to turn so that you can see better. Hinged forwards, spine long, chin is tucked softly towards the collarbone. We're going to come down into that lunge, knees over toes. So that's both knees. It might be that you're focusing on that front leg and not noticing what the back leg's doing. Now I need a bit more tension there. So is that back leg, is the knee going forwards there as well? Is your spine staying tall? So we're not flexing at the spine. One more. And let's hold and bicep curl. 8, 7, 6, 5, 4, 3, 2, 1, and down. Wonderful. Okay, let's step off that band, and we're now going to come safely down onto the mats. So I'd like us to spend a little bit of time lying down today, so bring yourself safely down. Best way to do this, if you have back issues, is to come onto your side and then roll onto your back. Okay, now, if your head is tilted back and you're looking at the ceiling behind you rather than in front of you, and you can't get your chin to here, or you feel like your head is lifted and it just wants to drop back, please grab some cushions and prop your head safely for me. Okay, we're opening the shoulders, and I'd like you to make sure that those bottom ribs are down and that the pelvis is sitting level. So if we think about the three bony points, the hip bones and the pubic bone, they should all be sitting in a level triangle. Okay, can you feel the same pressure on each side of the pelvis at the back. Bottom ribs are down, so we've got a level surface here. Now, before you start, can you turn the chin towards one shoulder? Can you roll that shoulder open and get more shoulder onto the floor? Rest on the little finger. Now turn the head the other way, roll the shoulder open and come back to centre. Have you got more shoulder on the mat now? Okay, so from there I'd like to visualise a marble sitting right in the middle of that triangle that we've created. And we're going to roll the marble from one hip bone to the other. So we're not forcing this movement, we're not really lifting the hips off the floor, you're just rolling it from one side to the other, to the crest of the hip and then the other. So think about getting level in the middle and then moving to the other side. So lots of little switching on in the muscles in the legs, in the glutes, a little bit in the abdominals, and back to centre. Now, I'd like you to just see how it feels if you try to roll that marble towards your tummy button. And then back to level. You're going to do that a couple more times for me. Now I want you to really notice where you're getting activation, what's switching on and how much. So it's not a forced movement, I want you to just gently roll without forcing on a breath out. Now how many of you are feeling that you're just pulling in at your waistband and creating a crease for that marble to roll into? Okay, nothing switching on between the hip bones and nothing switching on up here. So if that's happening, what we're going to think about now is let's take the hands there and think of drawing these hands together without using the middle. Okay, so can you think of pulling the ribs, excuse me, the ribs down and pulling the hips towards them? Did that feel different for you? Inhale, release. Ribs down, hips lifting. And release. You might even feel a bit of pelvic floor activation as you do this. So we roll the marble into the curved dip in the middle. So it shouldn't be a V anymore, we should be getting a nice smooth curve. And centre. Okay, from there, keep the shoulders open. Now if you've got lower back issues, you might want to just stay with this movement. If you haven't, how does it feel if you try and roll that marble away so that it drops down between the feet? Does that feel alright? If it doesn't, just stay with moving the other way. Now this movement shouldn't come from the rib cage. Let's think about keeping the ribs down as much as possible and tilting the pelvis. So if you need to be hands-on for that, we can go hands-on. Okay, now if that was feeling all right for you, we're going to put all 4 moves together. If it didn't, you're just going to do the 3. So we're going to do side to side and dipping towards the tummy button. Okay, but if it does feel okay for you to extend that way, then you're going to come into that movement too. So if you have spondylolisthesis in the lower back or spondylitis, then leave out that extension part. Okay, that's probably going to feel uncomfortable. Similarly, if it brings on any sciatic issues. Right, let's roll the marble to one hip bone, then roll it towards the tummy button, other hip bone, and then either back to the middle or roll it away. Back to level. Let's go the other way, towards the hip bone, towards the tummy button, other hip bone, and centre. Towards the hip bone, towards the tummy button, other hip, roll it away or centre. Now, how many of you are using your hamstrings a lot for this? Or your mid-back, are you pushing those ribs up? Try and keep those hamstrings soft. They will switch on a little bit. We've got one more. And back to centre. Right, from there, feet firmly planted, spread your toes out, toes are down. Can you roll that marble towards your tummy button and press into your heels? So there's no lift. Can you just feel how straight away your glutes switch on when you do that? Really push those heels down, release. Let's do that a couple more times. So we're not forcing the spine into the mat, we're just trying to get that activation from between the hips right to the ribs and down, and feel that that's helping to lift us off the mat. Now, we're going to take that into shoulder bridge. If you have neck issues, osteoporosis, osteopenia, you're just going to come to the bottom of your rib cage. If it's safe for you to come all the way up to your shoulders, then that's fine, you join me there. Okay, let's roll that marble. Now press into the heels. I want you to push the knees forwards as you lift. Push. Glutes should be working really hard. Push the knees forward. We're not pushing the hips up, we're pushing forwards. Take a breath in. Now exhale, start at the shoulders, roll down slowly. Can you get that feeling of the marble settling towards your tummy button before you roll it back to the centre? Did you get that lower back down before your hips? So again, into the middle. Pushing the knees forward, pressing into the heels. We're pushing, 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 lengthening. We're trying to get those knees over the ankles. Breath in. And start at the ribs. Shoulder blades down. Bottom rib down. Can you feel that marble go towards the middle? And then rolling back to that triangle. Lovely, one more time. Let's tuck under. Press into the heels. Push the knees forward. Are your big toes still on the mat? Push. So really feeling those glutes work. Breath in. And curl back down through the shoulder blades, through the rib cage. Imagine that marble settling into your tummy button before you roll it back to the middle of that triangle. Wonderful. Now that we've got the marble sitting in the middle of the triangle, we're going to turn the palms down, nod the chin, and we're going to reach the arms forwards. Can you lift them slightly off the mat, and can you feel that pull down under the armpit? And release. So that marble is still sitting in the middle. Reach. And release. Can you also feel a bit more contraction of the rib cage and the ribs pulled down and tight at the front? Now, can you add into that rolling the marble towards the tummy button? Reach, exhale. And release. So remember, we're not creasing. Can you keep that movement going for me? Just need to press something on the screen. Apologies, something's popped up. I can't see what I'm doing. There we go. So it's a nice strong breath out. We're not forcing the spine into the mat. Now, if you are working on a mat and you have neck issues, you can grab the corners of your mat and use them to help with the lift. However, if you do not have that, I'd like you to keep your head on the floor, and you're going to continue with feeling this activation. The ribs sliding down, towards the hips and pulling down from under the armpit. Okay, otherwise we're going to add in a lift. Knees pointing at the ceiling. Let's reach forwards. Feel that pull under the armpit. Nod the chin and push forwards. Are you still hollowing? Have you scooped that tummy in and rolled that marble? Let's roll back down. Reach, nod and exhale. So if you've got that chin nodded, keep that going for me. Breath out as you lift. You can see your tummy. Is anything pushing up? Are you getting a ridge in the middle? Are you getting a triangular bulge? If any of that is happening, keep your head down on the mat and practice that drawing in. Because if we lift when that's happening, we risk damaging our muscles, we risk damaging organs, okay? We risk hernias and prolapses. We don't want that to happen. So we are reaching forwards, nodding the chin. Exhale. If you are really reaching and getting that lovely curve, you are feeling pelvic floor activation too, I hope. And back down. Nod and curl. And down. One more. Rolling that marble. You'll see I've got a scooped hollow. Nothing's pushing up. And we're rolling back down. Okay, let's just turn the chin over one shoulder. And centre. And over the other shoulder. And centre. From there, let's take the arms out to the side, palms up. And we're going to step the feet a little bit wider. Now, hip replacements, you're going to keep this really small, particularly if it's only been 6 months since the operation. Otherwise, you're going to see if you can move a little bit further. Now, we want to make sure the ribs stay down. Let's drop the knees over to the side. Now, let them drop. Just notice, are you holding on to them? Let gravity take hold. Feel that stretch in the side of the hip. Keeping the rib down. Let's come back up. Exhale. All the way over. Now inhale, relax into the stretch. Exhale to move. Long breath out. Take a breath in. Exhale all the other way over. Inhale. Now let's add in the head if it feels good for you. So exhale, knees go over. We turn the chin the opposite way. Ear to the mat and your chin is going towards your shoulder. Exhale to move. Inhale to hold that stretch. Back up to the centre. Okay, let's step those feet back to hip distance. And we're going to take the knees over, look to the opposite hand. Let's bring it over with us. Place the hand on the floor, take a breath in. Now exhale, push up. And coming up into seated. Now, from there we need to come up into standing. So I'm going to get you to come up onto your knees first of all. So nice and safely. If kneeling isn't available to you, you could stay seated for this one or just come up into standing safely. But I'd like us to come into kneeling. If you've got your band handy, grab it. If not, doesn't matter, you can do this one without. We're just going to take that band across the thighs, fingers pointing down. Now this time, can you lengthen without pulling down through the armpit? Can you think of gliding your shoulder blades down instead? Chin back, ribs are down. We've practiced this connection today. Let's exhale, squeeze the shoulder blades together and release. So the shoulder blades travel down, we don't pull the armpits down. Exhale, think of pulling that that band apart and pulling round. Shin stays back, ribs stay down. We're going to do a couple more. Keep lengthening away from the knees. So it's a different feeling than pulling into the armpits. Shoulder blades move down. Pull apart, pull round. Let's do one more. Lengthen. Exhale, pull round. And release. Okay, give those shoulders a roll. Let's pop the band to the side. Now we're going to come up into standing safely. So I'm going to show you how to do that from kneeling. If you would feel more confident putting your hand against a wall or on some sturdy furniture, please do that, or come up in a way that's just safe for you. But we're going to do this from a single leg. You're going to step forwards. You want to have your ankle underneath your knee. Lean forwards into it, tuck your toes at the back. Now we have to push up through the legs. If you don't think you can do it, come up another way. Lean forwards, press into this foot, breath out, push up. Could you do it? Okay, very well done. So let's come back to that good standing posture. We're going to take a big stretch up. I'd like you to lift from the little fingers. Now think of pushing the little fingers up so that we feel a stretch go down the arms and down the sides of the body without popping the ribs forwards. Lift and reach, stretch, breath in, reach out wide and down. Okay, and again, scoop up, because we've worked those abs quite hard today. Very targeted work. So hopefully you'll take something away from that. Maybe you've learnt something new about how your body moves and what muscles you've been using. Just stretching over and down. Can we do one more to each side? Last one. And then we're going to take soft knees. We're going to stretch up, breath in, and a breath out. And thank you very much for joining me this morning. Do hope you've enjoyed that. And we're going to keep working on that abdominal activation and how to keep the spine safe with various different moves down on the mat over the next few weeks. Okay, take care and enjoy the rest of your day.